And if you look at it, it's grown. And it's getting more and more the case that more people are reporting either, especially anxiety and depression and eating disorders, the three disorders that we treated. So it's a big problem. It's such a big problem that counseling centers can't always handle the number of people who, if they sought treatment, could use treatment. Michelle Newman, professor of psychology and psychiatry at Penn State University. Screening a full population, the whole body of undergraduate students at any one college campus, and then delivering an immediate option for guided self-help, which is digital intervention plus a coach or a human being that's also interacting with them, is really a good thing that can help anxiety, depression, and eating disorders on college campuses and complement what's being delivered in person. We found that minority subgroups were much more likely to use the digital intervention than to receive at least one session of face-to-face treatment in the control group. We want to be able to use baseline measures or measures that they had before they started treatment to assign them to the best treatment possible right away initially. And we have done this machine learning study where we developed an algorithm that predicts who will do well with our guided digital intervention. And so we're hoping now to triage people into one group or the other group and see if that is better than just randomly assigning them to conditions. It's better because it's more accessible. It's easier to use. It doesn't require as much effort. You don't have to wait for an appointment. And the treatment that we used, I forgot to mention, also has coaching. So we have human beings who they are interacting with in text and emails. And there's some research that does suggest that in using apps versus human-based, that those are different people who some people prefer sort of self-help and doing things more on their own than others. And, so they might even prefer it. So I think there's a separate group of people. I don't think it's replacing or necessarily better. I think that the two things can exist together and make things better overall. It may be generational a little bit. There still are people going and who actually prefer face-to-face therapy with human beings right there. At the same time, I think it's a separate group that may be using this. Our hope is to do a follow-up study where we partner with colleges to use the algorithm that has come out of this machine learning to triage people who will likely do better to the digital intervention versus in-person interventions. Not everyone does well with any one treatment, and therefore it's highly possible that, again, it's different groups who might do better in one versus the other, and that can help the fact that a lot of colleges have very long wait lists that they're dealing with for people who are seeking in-person treatment also. Essential ingredients of some of these empirically based treatments for the disorders that we're treating are contained in these apps in the same way that they would be delivered by a human being. So I think it works, again, because these individuals aren't going out of their way. Either they're not going to seek treatment or they're on a wait list waiting for treatment and not getting it.